Now let's cover one rescuer CPR for the infant. Remember that we're still checking for scene safety. This could be an abusive scenario if it's out of hospital where the baby is down because of shaken baby syndrome or other abuse. So be aware of that. Also, you never know what condition you're getting into. Maybe there's fumes or gas or carbon monoxide in the home. If it's in hospital, maybe not such a concern, but we need to be aware of our scene at all times. That means gloves are on. CPR shield is available with a one-way valve to keep this baby's body fluids on its side and away from the rescuer. A lot of times we forget that infants could contract a contagious disease at childbirth, and they are not immune to that. So we still need to be thinking about infectious diseases and protecting ourselves. Then we're going to assess the baby for responsiveness. Baby, are you all right? Are you okay? There's no response and the baby does not appear to be breathing normally. Maybe they're having gasping respirations or agonal respirations. That's qualified as no respirations and the baby's not moving. We do not see any movement or hear any response. We're going to now activate the emergency medical services or call a code. Though we are de-emphasizing the importance of actually being able to feel a pulse in an unresponsive, non-breathing patient, as healthcare professionals, you are still allowed to check for a pulse up to 10 seconds. I prefer to do so myself. Practice makes perfect. But in checking the brachial artery on the inside of the baby's arm between the bicep and the tricep on the inside of that little humerus bone, we're checking for a brachial pulse for up to 10 seconds. Checking with the middle finger and ring finger, ideally. I do not feel a pulse. The baby's not breathing, not responding. We're going to begin 30 chest compressions, at least 1/3 the depth of the full chest of the baby. 1 and 2 and 3 and 4 and 5. Keep in mind that your 2 fingers are between the breasts on the sternum. Downward thrust at least 1/3 of the depth of the chest. At least 100 compressions a minute or more. After we do our 30 compressions, we're going to grab our mask with the one-way valve. Now, I'm showing this purposely because this is the most common professional rescuer mask around. Note that it's an adult size. There are pediatric size, there are neonate size, there are smaller versions, there's harder seals and more marshmallow-like seals. I prefer the marshmallow seal because it conforms to the baby's face and features better. If you're using an adult size mask on an infant or a smaller child, there's a technique in helping us to seal this. You'll take the smaller part of the mask that normally covers the adult nose and turn it upside down. This is the part that will seal over the chin, under the bottom of the lip, the bottom lip. Taking the other hand, seal over each side of and each corner of the face and the forehead. Bringing the baby's head into a neutral or sniffing position, we're now going to give 2 small breaths, enough to get chest rise and fall. If we don't get a breath, resituate your mask. 1 breath goes in by chest rise and fall. Another breath goes in by chest rise and fall. Reposition the fingers and start your compressions 30 times. We're going to do these 30 compressions followed by 2 breaths as a single rescuer until an AED arrives or until the next level of emergency medical services or advanced life support arrive to take over. Baby, are you okay? They don't appear to be breathing normally. Help, you in the red shirt, go call 911 or activate the emergency medical services or call a code and come back. I might need your help. Checking for a brachial pulse for no more than 10 seconds. I do not easily palpate a pulse, and there seems to be no breathing, no moving. Going into 30 chest compressions. 1 and 2 and 3 and 4 and 5 and 6, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Inverted mask over the mouth, sealing the chin, forehead, the sides. 1 breath goes in. 2 breaths go in. 1 and 2 and 3 and 4 and 5 and back up to 30 again, followed by 2 breaths. I will stop doing CPR in order to put the AED in place, or emergency medical services arrive and I turn the care over to them.